Integrative medicine. This concept is an old one, but is made popular in the 90s and more now in the millennium with Dr. Andrew Weil. Andy is putting together and has continued to teach MDs, DOs, other doctors the concept of traditional healing with regards to use of Western medicine in addition to nutrition, combinations of Chinese medicine and Ayurvedic medicine, and exercise, movement. It's a great concept and it's becoming more popular now. It's also becoming a better way of healing, whether cancer, heart disease, or just plain old diabetes. One of the biggest things you'll notice with integrative medicine is the use of nutritional supplements. Hopefully nutritional supplements, just like medications, prescription medications, will be very temporary until food and movement or exercise is maximized with the individual, depending on the medical problem, whether it's diabetes, ulcers, high blood pressure, cholesterol issues. Very common things that to take advantage of would be ginger for upset stomachs and nausea, or chromium picolinate for diabetics. These common things, which are very much available without a prescription, are unfortunately not utilized much with regards to prescription medicines or MDs and DOs. And that's the beauty of integrative medicine. The actual medical school takes advantage of about 2 weeks total of nutritional education. So it's very lacking, although it's very powerful. Western medicine does have its benefits, as I mentioned in the other video. One of the things that you can take advantage of with going to an integrative medical doctor is the fact that, number one, they'll take the time to listen, and hopefully your regular doctor will do this, but as I mentioned before, 80% of your diagnosis is garnished just with the history taking. And with Western medicine and sometimes the short time frame we can spend with our patients, we miss out on the history taking. So instead of just disease manifestation and disease treatment, we like to take advantage of exactly what is causing the problems, take care of what's imbalanced in the patient's life, and then hopefully address that in addition to use of traditional complementary medicines. This is the typical office space of integrative medicine doctor. Have the typical, again, it's the use of the prescription pad and the use of medicines or second opinions as necessary, but we also use other modalities for relaxation, breath control, smell, sound, touch, taste. These are vibrational. There's things called vibrational healing, whether by tuning fork, by sound therapy, by something as easy as sound. You can actually instill or start up the relaxation process, which 80% of the diagnoses we see in the emergency room are based on stress and the stress response. We don't get to learn about relaxation response when we're younger, and sometimes when we don't have that tool, the stress response just takes over and results in high blood pressure, anxiety, difficulty with sleeping. Sometimes you can even argue hypertension and high blood pressure and cholesterol. So something as easy as the peaceful sound of a bowl will set the process or set the time for a patient to relax. I remember going to work with a hospital initially. Everything was steel, white, and clean, and that's good for a nice environment, but it's not relaxing. And one of the beauties of an integrative medicine doctor is what we're taught with having the patient become at home, trying to get the patient to relax. And when you can get the patient to relax, the doctor or whoever the healer is can extract the true problem. Many times what we're taught is that the patient will be able to come in and know the problem already. They just won't be able to pick it out, and that's what the use of the integrative medicine doctor is for. So hopefully you'll be able to find an integrative medicine doctor. One of the best places to train is the University of Arizona, the Arizona Center of Integrative Medicine. There you can find, if you hit their website, a link to doctors in your area that have gone through the training. Stay tuned. In the next video we'll show you about alternative medicine and its uses and benefits.